Thanks, that's Graham. Yeah, it is actually laughable that Fianna Fáil are bringing forward this motion when they're, themselves and Fine Gael have been joined at the hip in deliberately capping health expenditure over the last 12 years or so and reducing the number of badly needed acute hospital beds and, disgracefully, the number of HSE staff under the three austerity governments since around 2007. On the Budget Oversight Committee, Minister, I suppose year after year we've looked at the budgets and we've seen, I think, inspired by people like Father Sean Healy and others who come to the committee to give us evidence and ideas, that consistently health budgets are just significantly too small. I mean, that's the bottom line. Like Budget 2020, which we got a few weeks ago, it gave estimates for the health vote group, the vote 38, isn't it, for I think it was 18.3 billion for 2020, 18.4 billion for 2021 and 18.5 billion for 2022. Now, where did the Department of Finance get those figures from? Very suspiciously similar kind of figures. So what about delivery of sláinte care, delivery of additional services? And I think everyone in the House and all our constituents know these estimates, they're just significantly too low to address the crucial needs outlined in the motion before us. And in fact, even the additional funding you did bring forward, Minister, for sláinte care, I think there was a 20 million integration fund and a 12 million core redesign fund, but we haven't really got reports on what's happening under that and like how that's going to help. But if you look at all your new expenditures, such as, for example, the 25 million you referenced for the National Treatment Purchase Fund, the 10 million for palliative care and so on, they're all simply too low, or they're certainly too low together. And they're leaving out crucial sectors of the health service. I think it's fair to say most people on the Budgetary Oversight Committee, we've consistently asked, for realistic, sustainable budgets, for a well-functioning health service, so that we don't keep coming back to crisis after crisis. But I mean, Deputies O'Donoghue and Deputy McGrath of Fianna Fáil together, you have agreed these 4 budgets over the last 4 years, which have simply failed to deliver that. I mean, that's the actual reality, and that's why it's ironic to hear the health spokesperson of Fianna Fáil today so upset about this matter. I mean, at 8 a.m. this morning, there was 360 people, I think, on trolleys around the country, with 174 waiting on wards, and that included 10 people on trolleys in Beaumont. And you can go across 30 on trolleys in the Mater, 8 in Crumlin, 23 in trolleys in Tallaght, 25 in Cork University, 23 in Mercy University Hospital Cork, 27 in Galway, 25 in Waterford, 30 in Limerick, and so on. And of course, one of the most despicable aspects of those statistics is that it was reported in October, Minister, that 107 children were forced to wait on trolleys for beds to become available. And Professor Malone, I think that other people may have referenced, the Master of the Rotunda, of course, has told us graphically that overcrowding contributed to one premature baby dying and 2 others being affected with meningitis, because of beds being so close together, and that there were around 4,500 premature babies born each year. And I think Professor Malone is looking for an additional, 50 million for NICU. Ms Eilish O'Regan, the distinguished correspondent of the Irish Independent, she reported, I think yesterday, Minister, that waiting list surgery will have to be scaled back in December and January to free up hospital beds for patients on trolleys in the overflowing A&E departments. And service plan targets, which you yourself set, Minister, to reduce waiting lists below 500,000 and the surgery waiting lists to below 60,000, reportedly you're now abandoning them. I mean, can you confirm that, Minister? Like other deputies, I've been writing and contacting Mr Paul Reid, the CEO of the HSE, and yourself since the spring about reports from health service constituents who briefed me on the 2019 embargo on staff appointments. Now, you denied, Minister, that this embargo is happening, and the Taoiseach has denied it, and Mr Reid has denied it. But I've learned of appointments, in fact, which were made, say, last April, and where the new workers, either frontline or support staff, where they'll be taking up their jobs next month. So that's, in January 2020. So that's clearly based on financial grounds, on administrative grounds, and that embargo certainly did happen, and it was disgraceful, and it shouldn't happen again, because we should have a realistic budget for 2020. So, in general terms, the motion lays out the horrendous aspects of our health system, and we have to support urgent action on it. Thanks, Karen.